Doctor, what are the oxygen delivery devices?
Well, if patient requires more than 21% of oxygen that we find in fresh air. So how to select the devices? So for an healthy person, the baseline saturation, which means SpO2, is 97 to 99%. And an older person, it is around 94 to 99%. But if the patient with COPD, aim is around 88 to 92%, who is on hypoxia rather than hypocarbia. So I will talk about the nasal prongs or nasal spec. So it is a nice way of delivering small supplementary amount of oxygen. They are convenient, comfortable than face mask. And as well as patient can eat or drink on nasal spec. But the negative point is we can't use the high level of oxygen rate, we can only use a low level of oxygen. So that is around 2 to 4 liters per minute, which is equal to 28 to 35% of oxygen. So next we will talk about the simple face mask. It is higher the flow rate is higher the percent of oxygen delivered. If faster the patient breathes in, the more air is entered by the side of the mask with the flow of oxygen, diluting the oxygen that inhaled. So roughly it is around 35 to 50% of oxygen delivered depending on the flow rate. These are the things we have to consider in simple face mask. So now we will talk about the third type of oxygen delivering mask, that is Venturi Mask. What you are seeing is a Venturi Mask. So what is Venturi Mask? It is a good way of controlling oxygen being delivered but also allowing higher flow of oxygen air mix. And each Venturi valve has a percentage on it and the flow rate required to deliver that percentage. The valve has a small slit in the side through which the flow of oxygen down in the middle drags air inside to equalize the pressure differential. And this is known as Venturi effect. So in this Venturi valve, we can deliver around 24 to 60% depending on the Venturi valves. So to change the level of oxygen, we have to change the valve. And what you are seeing is 5 valves based on the colors. And in detail, we will discuss it later. So next one, we will talk about the non-rebreathable mask. So if a patient needs more oxygen, then we go to non-rebreathing mask, which is like normal oxygen mask that has a reservoir bag. To deliver 85% oxygen to the patient, we use non-rebreathing mask, or we call it as high flow mask. So to use this, first the reservoir bag must be inflated before the use. And we use around 50 liter flow of oxygen and the mask should be tight fitting. Any patient who needs this type may need more attention in emergency department. So coming to the fourth type of oxygen delivering devices is flow oxygen is very dry. So to overcome, we use the humidified oxygen via the system, what you see here. The percentage of oxygen is controlled by the adjustable valve and the flow rate using the Venturi effect. But the oxygen is passed through the distilled water to humidify. Here the negative thing is that it is quite very wet and noisy, so we have to change it regularly to avoid infection. The percentage of oxygen delivered is around 28 to 60%. Yeah. So coming to the last type is the nebulizer. This is to deliver certain drug but not oxygen. It has a chamber where the liquid drug is built, air or oxygen is passed through the chamber, which turns into a fine vapor to be inhaled by patient. The patient will struggle to get the flow of oxygen or air in a nebulizer much above the 8 liters per minute, as the back pressure from chamber will cause it to blow off the wall. So these are the things we have seen in the oxygen delivering devices. See you soon in the next video. Thank you.